To please come over here for the welcome note.
Friends from the media, thank you very much for coming.
Dignitaries on the dais and members of the press. It's a very pride and with great happiness. I'd like to invite all of you here, and a very nice program. We can now introduce this Gleneagles heart failure program concept. Now, as I want to be telling you, heart failure is a very growing problem in India, especially in the field of cardiology. It has been recognized now only in the last 6 or 7 years that this heart failure problem is of a huge magnitude. It is not a small number. The numbers involved are huge, and for various reasons, it's also increasing. And also one main problem is this also can lead to further morbidity. That means reduction in lifestyle as well as threat to life as well. The left side is very much enlarged, is thinned out. This is what happens in a classical cardiomyopathy, heart failure, any other terminal phase of heart muscle damage. This is from a case in which patient died on a top. They always have to sit. Same thing is just monitored on a frequent basis. The medicines are monitored for. Diet is a single biomarker, a simple test shows how sick the patient is.
So simply, what is heart failure? You all heard about what is heart attack or angina, chest pain and all these other stuff. But what is heart failure? So heart failure is a condition where, heart is a pump. It has to continuously beat from the day of born, from the day of death. So when this heart pumping efficacy comes down, then what happens we call as a heart failure. It is not a complete stopping of a heart, but it's just the pumping efficiency has come down. Once the pumping efficiency comes down, what happens is the patient's quality of life will be severely hindered. So he cannot do any routine stuffs like walking the door or opening the door or even lying down. So these type of symptoms are high, and these patients are not managed effectively currently in India. Obviously there are a lot of hospitals which does heart failure management, but there is no comprehensive program to take care of the patient, counsel them, tell them what to eat, what type of lifestyle they should, and to improve the quality of life, which is very important. So here if you see heart failure, clinically speaking, it is a syndrome. It is not a single organ, because we all think heart failure means it's heart. No, heart failure is a condition where because of your heart pumping efficiency goes down, it affects various other systems also. So these type of patient, what happens is the management become complex because it's not a single system. It involves a lot of other systems in the body also. When the management become complex, the drug which the patient has to take also it's complex, a multiple medication. So the patient has to be put on 4 or 5 types of drug to make sure he is clinically stable. So when you put 4 or 5 drugs, obviously what happens, the drug compliance in the patient goes down. They don't take the drug, they forget to take the drug, and this leads to something very important.
Calves, lower thighs, and upper thighs, including the butt. The concentrated sequence, beginning with those, returns both arterial and venous blood to the heart. Then, EBCD has 3 distinct acute effects on cardiac function. First, because the retrograde aortic blood flow produces to rise to the heart just when the heart relaxes.
We are all here to talk about heart failure. I'm sure my colleagues have spoken about it in great depth. Unfortunately, this is the tip of an iceberg, using the proverbial, so often repeated, almost irritating, unnecessary phrase. But it is an insidious killer. Heart disease is an insidious killer. You never know how it hits you, but it does. There are many patients who are fortunate enough to suffer from multiple episodes of different kinds of ailments that lead to terminal heart failure. We are currently largely talking about that population. Unfortunately, when you reach that stage, there is very little that can be done or could be done. Fortunately, therapies that have been commonplace in the West are now available in this part of the world. The most heartening fact is that state governments, such as the AP government and fortunately even the Tamil Nadu government, are very seriously looking at funding advanced therapies for patients with heart failure. As you know, Dr. Ramswamy has just mentioned to you, he's working with the Tamil Nadu government on developing this and trying to help a lot of patients who probably are not either amenable for advanced therapy like heart transplantation and so on and so forth, but also for some of those patients who suffer from less milder variants of the disease.